Welcome to our video about the fungus behind your ear. You should seek medical advice if you suspect you have fungus behind your ear. This type of infection is common in warm climates and tropical countries. Antifungal eardrops and creams are available to treat this condition. Antifungal creams and eardrops can be applied to the outer ear and soften the crust, which allows the medications to penetrate better. It is not wise to try to clean the ear yourself. Otomycosis is a fungal infection of the external ear. Otomycosis is a common type of fungal infection of the external ear, characterized by white or black debris in the ear canal. Treatment is typically an antifungal solution and may include m-cresyl acetate 25% or 2% gentian violet. Treatment can also involve surgery to remove infected tissue and culture it. Otomycosis commonly presents with itching, irritation, and a scanty discharge. It can also lead to hearing loss or tinnitus, which are both symptoms of bacterial otitis externa. However, treatment may require oral antifungals. If left untreated, otomycosis can become chronic, requiring oral antifungal treatment. Otomycosis is a common condition affecting people who live in warm climates. It is more common among people who work in hot, humid conditions and participate in water sports. The good news is that otomycosis is easily treatable with topical antifungal medications. It is typically caused by Aspergillus or Candida species, though other fungi can also be a cause. Otomycosis is highly prevalent and has many causes. Fungi are widespread in the world but are particularly prevalent in some parts of the world, such as Akiti state. In addition to environmental factors, ongoing construction and improper waste disposal can provide an ideal habitat for fungi to grow. These factors may also contribute to the dispersal of dust particles. Otomycosis is most common in warm, tropical climates. Because the fungi thrive in moist, warm environments, people who spend a lot of time swimming may have a higher risk of contracting otomycosis. People with weak immune systems and those who have diabetes are also more likely to contract the infection. People with chronic skin conditions or a history of immunosuppression may also be at risk. Symptoms of otomycosis may be accompanied by discomfort and pain. Your doctor will recommend a course of treatment, which may include eardrops, topical creams, or oral medication. The first step in treating the infection is to prevent it from returning. You should avoid swimming, scratching, or using cotton swabs in the affected ear until the infection has cleared. It is more common in tropical and warm climates. Bugs and other creatures are the primary vectors for the spread of many types of diseases. Because of their high diversity, the tropics are perfect for these insects to breed and lay eggs. While many bugs feed on the blood of other animals, many mosquitoes carry diseases. These include malaria and Lyme disease. People living in tropical and warm climates are often poor, making them more susceptible to the spread of these diseases. The Earth's tilt and rotation, as well as the land/sea distribution, determine global weather patterns. While weather varies day to day, the same type of weather reoccurs over many years. This recurring average weather is called a climate. Most tropical moist climates are located at equator levels and are surrounded by mountains. Climates in these areas are typically mild, with temperatures ranging from 10 to 30 degrees Celsius. The difference between tropical climates and cold climates lies in the timing of rainfall and temperature variations. While cold and flu infections are primarily winter things in southern Australia and other parts of the world, tropical regions have year-round transmission and distinct epidemics and spikes twice a year. It is important to understand these differences when traveling abroad. If you plan on visiting the archipelago in the future, make sure to take precautions. The most important difference between warm and cold climates is the amount of precipitation. Tropical climates receive more precipitation and have no winter season. However, they are not as humid as warm climates. This is because the sun is more directly overhead and warms the tropics. A tropical climate also has a higher degree of humidity than a cold or dry climate, making it more likely to experience heat waves and tropical thunderstorms. It causes a rash. A rash behind the ear is often unnoticed until it becomes itchy and painful. Treatment depends on the underlying cause of the rash. If it's a fungal infection, a prescription may be needed, as can topical antibiotics. For bacterial infections, you may want to apply antibiotic skin cream to the affected area. Washing the rash frequently is an effective way to minimize irritation and itching. If you notice any bleeding or weeping, you should call your doctor. Getting a proper diagnosis is important, as the ear canal can harbor many different fungi. Your practitioner may use an otoscope to look for the presence of fungal spores. Alternatively, a sample of the pus from the ear canal may be taken for laboratory testing. In any case, it's vital to get a proper diagnosis, as the fungus behind the ear can spread to other parts of the body. The area behind the ear can be affected by several different types of skin infections caused by fungi. Ringworm, for example, causes an itchy red rash, which is often associated with swelling. Lymph nodes are small glands that contain cells that fight infections. Some lymph nodes are located behind the ear, and an infection in the ear may lead to an enlarged lymph node. Contact dermatitis is another cause of this rash. This type of skin infection occurs after contact with an allergen. This type of rash may occur on anyone's body. Despite the fact that it's highly contagious, contact dermatitis can be painful and can develop into an atypical condition if not treated. If not treated immediately, it can even lead to life-threatening conditions. Another viral infection that can cause a rash is measles. It begins on the face and spreads to the ears and the rest of the body. It can be a very serious and fatal illness in young children, though modern vaccines have reduced the incidences. The rash may look like a flat red blotchy patch. Some of the other symptoms of measles include a high fever, a runny nose, and eye inflammation. It is treated with antifungal eardrops. If you think that you might have a fungal ear infection, you should visit an otolaryngologist. There are a variety of ways to get it, including using contaminated water, cotton swabs, or ear candling. The goal of treatment is to clear the infection so you can resume your daily activities. Antifungal eardrops are an excellent way to treat this condition. Make sure that you use them properly and only use them for the prescribed duration. You should also avoid using the eardrops on your own. These are only effective if the ear infection is not due to a serious condition. Usually, these eardrops do not have a strong enough effect on the fungus to make it cure itself. You may also want to try an antifungal cream to apply to the outer ear. This will help soften the crust of the ear so that medications can get to work better. Several different medications are available as eardrops. Generally, antifungal drops contain fluconazole, miconazole, or clotrimazole. Your doctor may also recommend an antibiotic if you cannot tolerate the topical medication. Antifungal eardrops also help relieve the pain associated with otomycosis. A doctor may also prescribe nonsteroidal anti-inflammatory drugs, NSAIDs, or acetaminophen for pain relief. Using home remedies is also helpful, including using hydrogen peroxide to clean the buildup in your ears. The diagnosis of otomycosis requires a thorough medical history and a thorough examination of the ears. The doctor may use an otoscope to examine the ear canal. Occasionally, a swab of your ear will be used to collect a sample of the buildup and discharge. If a culture shows the presence of fungus, it will be removed. Fungal infections are more common during the warm months of the year and are usually caused by the same bacteria or fungi. They typically affect the outer ear, auditory canal, and eardrum. If you have fungal ear infections, it is very important to treat them as soon as possible. Fortunately, there is an effective treatment for otomycosis. If you are unsure of what type of infection you have, you should visit a healthcare practitioner for an appointment. Thanks for watching. Please like, comment, and subscribe.